Hi, I'm Shannon McNall. I am an advocate for the Children's Tumor Foundation. I'm also a volunteer for about 10 years. And I'm here today to talk about our family's struggles and triumphs and really get some feedback from Dr. Walsh about having all this in COVID. And hi, Dr.
Okay.
Walsh.
Hi, how are you? So I'm Dr. Walsh. I'm a pediatric neuropsychologist at Children's in DC and have been involved in the NF world for 15 years now. So I'm thankful to join you for this conversation. COVID's brought a lot of interesting challenges and some highlights in some ways to our lives in a weird way. So I think this conversation hopefully will be beneficial to all of our families with children with NF or all kinds of different challenges that may come up. So I'm looking forward to our talk.
Good, sounds awesome. I'm excited too. I guess I'll tell you a little bit about our story. My son was diagnosed with Neurofibromatosis 1 at age of 6 months. So we've known most of his entire life. We've basically spent the past 13 years getting his appointments together, getting his anxiety brought down, helping him out socially. And COVID has really put a damper on all of these. I mean, it's completely turned his little world upside down as far as appointments, as far as his friends, as far as just trying to figure out how to fit in. And that's kind of what I wanted to reach out to you a little bit about, is really hearing your opinion on how we can make it better for them.
Yeah, I mean, I think that it's thrown us all for a loop as a family unit, right? So it's easy for us to think about our one kiddo that might have special needs or have some different unique challenges, but the reality of it is it's made us all have challenges in some ways, right?
Yeah.
You know, and I know, Shannon, you're going to share a little bit more about your own family's experience. And, you know, so I think that this has disrupted, especially in your case, where we've talked a little bit before about you had reached some nice stability and then this sort of thing happened and everything changed, you know. So I think it's like the disruption that's happened to all of us, but heightened even on some level because you've worked so hard and he's worked so hard and so long on finding the right space and the right environment that fits him well. And now it's like, let's do this a completely different way. And flexibility is not really necessarily the strength of a lot of kids with NF. So kind of making that shift is sometimes hard to, you know, virtual everything, whether it's doctor's appointments, some of them, or school, or, you know, and then taking them out of this social context. So I think that we've all been put in this situation without a manual, right? And I've even said as a professional, I'm in many ways learning right along with the rest of you in trying to figure out how do we navigate this? How do we make sure schools are still providing the right level of supports to these kids that already had IEPs or 504 plans? You know, what's doable virtually, what's not. It's really a challenge, and there's a lot for us to learn together and figure out together. And I know you have some good examples of that scenario as well for us to maybe talk through.
Yeah, I definitely. It's been a roller coaster. So with Carson's teletherapy appointments, that's been one of the biggest things for us to really adapt to. Carson, he only has 3 teletherapy appointments now. He's not doing any, obviously not trying to do OT over the computer or anything like that. And it's been a real struggle for Carson to try and, like, because they're counseling appointments, they're speech appointments, they're appointments where you need to be interacting like with somebody in person. And all of a sudden he's just looking at a computer screen and he's not quite sure how to properly react. Maybe is that something that's common? Or
yeah, I mean, you know, there's certainly the benefits of telemedicine because we can still provide some level of service or interaction with families and kids, but it's certainly very different. And I think for a lot of kids, you know, not being in a room with a person doesn't work so well for them, that they do struggle with how do you interact. I mean, we all think this is a little weird at times, right? This maybe you're getting used to it, but I think there is this for many kids, particularly, you know, if they have difficulties with attention or other things, that lack of a human engagement and it only being done through this virtual means sometimes makes it hard for them to feel engaged. And I think certainly if you have any difficulty socially, even one-on-one in real life, I think it's exacerbated by this virtual environment too, because you don't even get to see all of somebody's body language. You're sort of limited to what's on the screen. And some of us aren't that good at doing this virtual thing either, right? If as a clinician, you're in the office, there can be distractions or things that are making it that you normally wouldn't have if you were working in person. So I think to me, it's like everything. There's the benefits of, thankfully, we have this technology to even continue some level of care. I don't think anybody thinks it's equivalent necessarily to what we were doing, whether it's in quality or quantity per se. But the downside is exactly what you said, is it's not engaging enough for some kids. And this applies to school too, I believe, that for some of the kids, especially with more, again, attention or regulation difficulties, just feeling engaged, it's going to have a lot to do with how a teacher might manage that session or a clinician might manage the session, to realize we've really got to we got to work harder on our end to keep it going, right? And keep kids feeling like it's something they really want to be doing.
That's one of our, I actually love the teletherapy appointments because I don't have to drive anywhere.
That's right.
Like Christmas a little bit for
that's right.
But it's getting them off.
The other benefit of telemed, I'm sorry, Shannon, the other benefit of telemed is we actually get to see each other's full faces, right? I always have telemed visits ahead of any in-person visits, because for kids that haven't met me before and I haven't met them, it is actually nice to have a session where you can see what we look like without our masks and the things that we need to do when we do have an in-office visit. So, and to your point, it's helped with time management and transportation and everything with having this ability to do this.
I'm not quite sure what we're going to do when we go back. I'm like, I'm going to have to cut out a whole another 5 hours out of my day.
That's right.
Things like that.
That's right. I
so
think
one of my other things,
go ahead.
I'm sorry. Kirsten has really struggled with COVID itself. So my husband had COVID, and it wasn't the worst case, but it wasn't the best case. And so the kids saw him be really sick. And with my daughter, she's kind of been able to adapt to it a little bit better with the family life and with society. My son is definitely one of the ones that it's brought out every bit of his anxiety that you could possibly have. I mean, he's the one who the school teacher, they're like, we never worry about him wearing his mask because he's always wearing his mask, and he'll tell everybody else to wear their mask. And that anxiety is really festering to the point of where I think it's hurting him at school because he's so focused on it. And he goes hybrid, so he goes half time. And kind of like to hear your thoughts if that's common too.
Yeah. And again, you bring up a good point, because a lot of kids with NF have some baseline anxiety that, then something like this could certainly spike. And particularly if kids have any anxiety about not being well in general, then of course this would really be a significant event for them. His father having COVID, I think, certainly ramps that up, probably for any child. But if you have some base of anxiety already, that's going to make that much worse. And anxiety is a challenge and a problem with thinking flexibly. A lot of kids that have anxiety kind of see things as a little more black and white. So all this, and we're living in like this very unknown gray area, again, for all of us, because we don't really understand everything about COVID. We don't know how it acts. We don't know all the rules. I think we've all felt a little bit of upheaval of not really knowing what we're working with. And so for children, I think that's certainly much harder. They are going to take, normally for anxiety, they're taking cues from the adults around them, but I think many of us adults are feeling like we don't have the answers for them, or we don't know either. I think we're feeling the same way as our children in many respects in terms of some of the, uneasiness about it. So I think it's hard as a parent then in many ways to feel like you can have some positive impact on a kid's anxiety around it, because we have our own level of unease, most likely. But yeah, I think that The key to anxiety, and when we're trying to work with kids on anxiety, is to not get rid of it, actually, in essence, is to, now certainly if this is getting to such a significant level that it's really impacting their whole day, we might need something more professional to help kids through this time. And I think there are a lot of kids that are experiencing anxiety and mood disruption, because of the isolation or the anxiety around becoming ill, or somebody they love becoming ill or not well. So it's really brought up a host of emotional difficulties for many, many kids. And again, if you already are starting with some level of that before COVID, I think we've seen this really kind of spike for kids. But we're essentially trying to help kids learn how to proceed despite anxiety, right? So anytime you're working with kids with anxiety, that's the goal. It's not to make it disappear, because it really doesn't, but it is to help teach them tools, right? For saying, okay, I'm somebody who gets anxious about this, and I'm going to first acknowledge that, like, that's my thing. I get anxious about things like this, but finding ways to help them have tools to say, like, I'm going to go to school anyhow, or I'm going to, proceed through the things I need to do, despite the fact that I have anxiety. I'm going to acknowledge it and let it be, and learn how to sit with it and then still move forward. Which seems counterintuitive, because all of us parents are trying to help we want our kids not to feel anxious, right? Anxiety is a pretty significant emotional challenge, and one that can be very disruptive. To your point, he may be ruminating through the day on all this COVID stuff, and do my friends have their masks on? Is everybody washing their hands? Do you have hand sanitizer? So you can imagine what that does to him through the day, as he's, supposed to be sitting there focusing on learning, right? But in his mind, it may be really kind of hung up on this, are we safe kind of anxiety, right? Is everybody protected and okay? And that can really distract from their learning potential in those settings. Is he less anxious at home, like when he's doing the virtual days? Is it mostly the days he's in school?
He's actually much less. Sorry, my computer keeps lagging a little bit. I'm sorry if I'm interrupting you.
No,
I apologize. So he, with online schooling, he's not anxious at all. He loves it, but the problem with the online schooling is kind of, I have my daughter, and she gets online and she does her homework in like 20 minutes, 30 minutes, and she's done, and she's thriving on it, although she probably needs a lot more to do with it. And then you get him going on there, and he is all of a sudden, like, he's either lost his focus within 5 minutes, or he can't find or navigate where he's going. And I'm not sure if that ties into the executive functioning or what's happening. It's a really big struggle for him to try and navigate online. And it's a real big struggle for the whole family, because I'm constantly having to sit with him and remind him.
Yeah. One of the things that I feel like I've seen both in individuals I'm working with and in my own personal family, frankly, is that this virtual learning seems to have added an additional layer of executive function demand. So it's a great point you bring up about executive function. We know, again, that for kids with NF, at least aspects of executive functioning aren't necessarily their strengths. So they may, even in a classroom setting where they might either have supports around executive function and attention that may or may not be able to be implemented virtually in the same way or with as much success. But I feel that, from what I'm hearing from people, this, the virtual learning has added an additional layer of executive demand, because now, you have to figure out, where's this document that we're working on? How do I turn in this new work? Whereas if you were in class, you'd be handing a paper, and now you have to figure out, how do I save that and upload that? And I don't know, maybe the kids are navigating this better than I think, but there seems to be more steps to every process, right? Whether it's finding something or submitting something or engaging in something. So it feels like there's a lot of extra levels that could exacerbate, again, the difficulties for kids that may already struggle with engagement, attention, executive functions. So, you put that all together, and I think many kids are needing their parents to be sitting next to them and helping them with that executive demand, right? Of, Are you checking your email? Do you, things that wouldn't be happening in the class. And I also think even there's classes that have homework now that if they were in school, they wouldn't have homework. Like we generally don't have PE homework and art homework and music homework. But now, since everything's virtual, at least, my experience has been they have work to do and turn in these classes. So it's even additional workload in some ways, or at least independent level workload that I think, again, can create some additional challenges. The flip side of that is some kids are doing better virtually, because they can have their space the way they need it. They have parents that have figured out how to set it up and what they need to be successful and be more independent. So it's a mixed bag in some ways, I hear different stories from different people about whether it was good or bad. And I think it probably depends a bit on what school looked like, whether it seems better or worse, right? And I know that you and I were talking a little bit about, just the level of services and then what happened with COVID. And maybe you'll speak a little bit to that with Carson's services and how much he was getting or not getting and kind of figuring out what to do with all that, right?
Yep. Yeah. He definitely, I explained this to you a little bit, but so Carson, we've spent, probably 5 years getting the perfect IEP together. Well, nothing's perfect, but it was pretty close. And so now coming back into COVID for the halftime learning, they've cut a bunch of those services back because he's actually doing better in the classroom in a class size of 10 people versus a class size of 30 people.
Yeah.
And we're finding that we have to re-fight, and maybe fight isn't the right word, re-advocate for him to get his services just within the classroom. Because the second we go back, COVID is not going to be around forever. It can't be around forever. And this is not going to be the normal forever. And so we're really struggling, and I'm not sure if this is common with all other families too, really struggling, trying to just keep his IEP up.
Yeah. I think that's also been another significant challenge. And even one, I guess, again, on the professional level on my side of really trying to understand what that all means and what do we do about it. Because I think that, the spring was interesting, I think, for most schools and most families. And it was just like, I don't know how to describe it, but there was no system. Okay, right. We were all just kind of winging whatever was really going on. So then we had the summer, and then the fall seemed to at least be more organized for most school systems. They had an opportunity to sort of get some plan together of some sort. And, it is interesting because some things that are included in IEPs are completely doable virtually. And some things are a lot more challenging to try to kind of do virtually. It's unclear sort of where we are with regard to IEPs and special education services, because I'm not sure if schools really know what to do with all of this in truth, right? I think this has all been a real disruption all around for families, for school systems, and everybody's trying to react to this and get reorganized. My suggestion has been to most families is really to keep documentation as much as possible during this virtual or hybrid scenarios about all your experiences in many ways. So things that were taken away that you agree or disagree with, right? To keep these notes about this, to document any impact you feel that you've seen because of a decrease or a change in service availability. I also think anything you've done at home that has worked, that you've seen a benefit of, I think can be used as an example of what somebody may need when they do all go back, or if things become virtual again, or whatever it is, right? I think we don't know where all this goes. So we're trying to be prepared for any scenario and what's appropriate for each of these children who have been identified as kids who get support, need support in different areas, right? So I think documentation is a big one, because I think when we get back to school full time, whenever that happens, I feel that the most likely thing that's going to need to happen is, kind of new IEP meetings and figure out where are we now. It's almost not a start over, but I think I think most parents I would encourage to be asking for meetings at that point or before then. In your case, if this does not look right and does not feel right and it doesn't seem right, you know, there's no reason not to request meetings. And I would assume they're probably doing a lot of those virtually now, but they still can happen, right? And I think all the same legalities still apply in terms of if you've requested a meeting and the timeframes around that. I'm assuming, I haven't heard otherwise, that that's waived in some way, right? So there would still have to be a reaction to a request. You know, again, that may not turn out in the end the way that you want, but it's okay. Like, you know, that you're part of that team. You know, you have the right to advocate for your children no matter what's going on. And I think this is probably more now than ever, frankly, that we have to sort of advocate or re-advocate for our kids to make sure that things don't fall apart now. And I can only imagine how you feel working as many years and as hard as you guys have to get this sort of right, as right as it has been for him. And then to have all this happen and fear, you know, this falling apart after so much work and so much effort on his part and your part. I'm sure that is highly anxiety producing and uncomfortable and might even make you upset. I can imagine.
It does. It's not upset. And I think this is one of the things that I was really thinking about after I spoke with you the last time, was how exhausting it is for parents right now, like for the family structure, for like just our whole family in general, is because we're doing all of these things and not necessarily taking care of ourselves as adults because we're trying to keep the kids going. And is there any suggestions, I guess, that you have for parents who are just, because we can't give up on them, we can't not let them do virtual school, but is there a point that you just let it go a little bit? Or
yeah, that's always the hard part, right? Because again, I think, you know, I think the main point that you bring up is, I think that families with children with medical, you know, chronic medical conditions are generally don't get enough time or for self-care and don't get enough respite and don't, you know, put time aside for themselves to get those things. And that's certainly not a critique. It's sort of, it's just how things happen. But even no COVID involved, I'm often talking to families about spouses or couples having dates, getting, you know, people to come watch the kids, to getting a break and getting some time for self-care, or even again, individually, where, you know, you get to, you come up with a schedule with your family of who's going to get some time to themselves. And, or I think in COVID too, the other thing that's happened, which may be a positive, is I think you always need alone time, but even families going and getting more physical exercise outside, spending more, you know, downtime together. Because the truth is, when everybody's very anxious about school, in many ways that for many families, that has more to do with the social, emotional functioning and development of our kids than even the academic. I mean, there's concerns about both, but I think a lot of families are really worried about the isolation. You know, we're all in our homes kind of 24/7-ish, or somewhere close to it. And it's not easy. And I think that actually has taken this self-care issue again to more of an extreme, because it's sort of exhausting. Your parents are now playing more roles than ever in their kids' lives. You know, we all know that our kids are going to listen to their teacher in a different way than they listen to us, but we're it, right? So it's exhausting. And so I think it's really brings up that we need to try to be more cognizant about self-care more than ever, because it is true that if we're as parents not doing well, it really does, it sounds cliche, but it limits our ability to help our kids and to be, you know, in a good frame of mind so we can model positivity and flexibility and all the things that they need to do right now. And they need to be able to handle, you know, if we're stressed to the max, we're also inflexible and emotional. And so, you know, the best way we can model for our kids things we really need them to do and learn is having some ability to have self-care, which means you have to have a break from it all. You know, you have to find some way that you can break off, and with some regularity, right? Again, it doesn't have to be, a trip to the Bahamas for a week or something. It can be, making sure you get outside, making sure whatever you enjoy or an activity you enjoy that you get to go do on your own. Now we can't, us moms can't all go to Target and sip our coffee as we're walking through as easily as we used to for a break. So we have to find some new things.
Oh, I love that advice. That really is one of the biggest struggles I think that we're going through right now.
Yeah.
Is really just taking care of ourselves. I don't know if my husband and I have had a date since COVID started.
Right.
In all honesty. And I worry about my daughter too, I guess, a little bit. What about the siblings with these kids right now? Because I know we're putting in so much effort towards helping our children with disabilities, that she's doing great, but is she actually doing great?
Right. Yeah. Yeah. I mean, that question reminds me a lot of when we're working with, outside of our NF work, we work a lot with kids with brain tumors or leukemia, and that's actually a really big topic in that field, unrelated to COVID, but to the point of having a child that has either medical, learning, or emotional needs pulls you in that direction, right? And I think, again, especially with COVID and having to make adjustments, again, being focused on making sure that he's not losing his supports that he's done so well with. And so, more of your energy likely has to go in Carson's direction. And I think it's a valid point. And, sometimes you're thinking, I guess the sibling's doing fine because they're not complaining about anything, but you always have in the back of your head, like, are they though? Like exactly what you're saying. Yeah, I think, depending on the age of the sibling too, and how open your communication is, I think it's good to have some set aside special time with that child and to be able to have some conversations about that. And just, I think being honest about it, like, I know my attention's probably brought here, and you're seem to be doing this amazing job, but I really want to check in because I'm sure this is actually very hard for you too, making these adjustments. And also maybe you'd like more time with me, and again, some kids are going to be more open to the conversation than others, depending on their age and just their personalities. But I think it also, even if you don't have a real in-depth conversation, just making a point to set aside time, like, we're going to go, for a walk, or if your kid likes to kick the soccer ball or do art or whatever it is, to really set aside that time, like that's just for me and you, or that's just for you and your dad, or me, you and your dad. And, and Carson's going to hang out with, a neighbor or friend or somebody, whoever you can do that with at this point. So I think just making a point to kind of set aside some time for the siblings can be really a good thing. And I think if they have something to say with enough of those sessions and those interactions where they're alone with you, they'll probably bring it up if they're struggling with something most of the time. So I think that can be important. It's a really good point though. When somebody's doing well, you just let them do well, right? You're just like, okay, great. I'm glad you're doing so well because I've got no energy to help anybody else right now. And the same thing happens in the classroom. We talk about kids with ADHD that are not very hyperactive or impulsive, and they kind of slip through cracks, right? Because they're quiet, they're not bothering anybody, but the reality of it is maybe they're, missing a bunch of stuff, but they don't get noticed. And I think it's similar in family dynamics sometimes where the person who's just kind of trucking along, you're like, thank you. But then you worry a little bit about that. So yeah, I think setting aside unique time for each kid can be helpful in that way.
I'm going to do this. You've given me so many, both my husband going out and now the kids.
Yes.
I'm like, we need to spend more time on our family. And I think you've really pointed that out just now in this conversation.
Yeah.
That's about the only questions that I had. Is there anything that you feel like was brought up that we missed talking about, I guess? I'm
sure there's a million topics that people have and, from their own experiences, but I think we've hit on some really good ones and some highlights at least. And perhaps we can have more conversations, like this. I think this, again, hopefully us recording our conversation is helpful to others. And as we keep navigating this, there may be an opportunity for us to talk again. And you may have learned some new things that are helpful to families after you have some dates and some other family time. I think you bring up a good point, though, when it comes to something so significant. None of us have ever experienced something like this. The focus really goes to what's most important. And that really for us, most of us, I think, is our families. And if that means that, school is just a hair below where we would be hoping for normally, I think that's worth that sacrifice. Because if your unit is not functioning well, the rest of it doesn't really matter and isn't going to go well either, right? So I agree with you. The focus on the family and nurturing all those relationships and taking some of the pressure off by getting breaks and getting, time to help yourself out and make sure you're doing okay and your husband's doing okay, and each person, that just allows you guys to help each other more through all the most challenging pieces of all this. So I think that's a great topic you brought up.
Thank you so much. I really am super excited. I'm like, ooh, what are we going to go do?
We have to talk again so we can hear the updates.
Yes, definitely. Well, thank you for taking the time to talk to me today.
Yes, my pleasure. Always good to talk.